1FM, AM 1160. Good morning, 7:45, our Teddy Bear Fun Drive time. In the studio with us this morning, Abby Caylor, IRMC nurse practitioner, Sara George, the stroke coordinator at the Indiana Regional Medical Center, which is a private. Help me, Sarah. Say it correctly because I know I won't.
A primary stroke center.
A primary stroke center. There you go. Our conversation is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. What does that mean, primary stroke center?
Primary stroke center just means that we have the correct capabilities to treat anyone who comes to our facility for an acute stroke. So that means that we work with our emergency pre-hospital team at Citizens Ambulance, and they are able to let us know that you are coming to the hospital with stroke symptoms. When you get there, we have an acute stroke team, and we have the proper imaging, and we are able to treat you with the proper medication if you come into the emergency room for a stroke.
One of the things when I've talked with people at IRMC about stroke that amazes me is how it's so procedurally aligned. Everybody knows what they do. Everybody knows what the role is. Abby, and it just amazes me that the roles they play out. It's just like a drill.
Yeah, we're very fortunate here. We like to say in stroke work that time is brain, and it's one of these instances where it is essential that you get to an emergency room. As Sara mentioned, it's the only place to be safely evaluated for a stroke. So when you have stroke symptoms, you need to get to the emergency room as soon as possible, and you're very fortunate to have a primary stroke center in your hometown and in the surrounding area so that they can provide immediate care to reverse a stroke or coordinate advanced care if that's needed.
But something you said, it rings a bell. When you think you have a stroke or when you have stroke symptoms, some people just won't. There's Chris Letang had his. He said he had migraine headaches. But he had a stroke history. He had already had a stroke in his lifetime. So he's extra vigilant about a migraine headache. For most of us, that's not the case. So what are those signs we should be looking for?
We use a nice mnemonic called FAST, which are the classic signs of stroke, which are facial droop or changes, arm weakness, and any speech changes that you might have. If you have any of those symptoms, those should be cues that you should be evaluated for a stroke. There are some symptoms, like Chris Letang's, that may be less obvious stroke symptoms, such as severe headaches and dizziness and nausea, which might not trigger us all to think of a stroke, but we should be more in tune with those symptoms, should really be evaluated, especially if it's a sudden severe headache.
Yeah, and especially if you have a history like he does.
Absolutely.
Yeah. So, Sara, when we think about it and the attainment of the primary stroke center designation is not an easy thing, is it?
No, it is not. So we follow guidelines and recommendations through the American Heart Association, and then we also have further standards that we follow from our accrediting body.
Mm-hmm. Mm-hmm. So we find out about the stroke. We go to the ER. We're evaluated. It's determined we're having a stroke. It goes then from there to the next step and the next phase. What kind of a stroke is it is one thing that we have a question about because there are different kinds. Mm-hmm. What are those kinds?
So the two main types of stroke that you will see is, number one, is an ischemic stroke. What that just means that there is a blockage in the blood flow to your brain. So every second that blood isn't flowing to your brain, that's why we say time is important. And then the second type of stroke would be a hemorrhagic stroke, which is where there is a rupture or a breakage in the blood vessel in your brain, and there's actually bleeding in your brain.
Is the treatment radically different from one type to the other?
Yes. So for an ischemic stroke, we use a medication called TPA, and what that does is it works to break up that blood clot. So that is very time sensitive. There's only a 4-hour time window from your onset of symptoms where we can give that medication. So that's why we urge everyone to get care as soon as possible.
Yeah, okay. Now, I'm assuming that the amount of damage that someone has, Abby, is going to be pretty much related to, A, how quickly they are evaluated and treated, B, the type of stroke that they've had, the severity of the stroke. All of those things will factor into it, but some people are going to have afterwards maybe no symptoms. maybe very minor symptoms or minor effects of it. For some, it's quite major, isn't it?
Yes, you are correct. Stroke symptoms can be very mild, and some people may even have small episodes called transient ischemic attacks, or TIAs. And those are when you have signs and symptoms and they really dissipate or go away on their own within a short period of time. We would encourage people to be evaluated even when that happens. So you can have very minor symptoms, which you completely recover from, to very devastating symptoms based on factors such as your blood pressure, your personal health history, the size of the stroke, and the area in the brain in which you have the stroke, and the different motor or sensory or language functions that area of the brain controls.
Is that what we used to call mini strokes?
We did, and I don't think we like the word mini so much, but we call them reversible strokes, or TIAs. So a small event in which you recover completely without intervention from us, usually within an hour, sometimes up to 24 hours, but with no residual effects, and we really can't see that stroke persist on the imaging of your brain. So again, time is of the essence. I guess we can't stress that enough, because when you present to the hospital, like Sarah said, within a few hours, we're really able to provide care that it has the potential to reverse the stroke. And then it's very important also that the stroke team evaluates you and you work with a rehabilitation department to gain back as much function as possible if you have had deficits occur.
Yeah. And I want to get into that next. And again, we're talking with IRMC nurse practitioner Abby Caylor and the stroke coordinator at IRMC, Sara George. Sara, after the treatment, after the, let's say the life-threatening aspect of it has been taken care of and someone is stabilized and then moves forward from there after a period of time, it comes rehab time.
Yes.
And that's part of your mission as well, is it not?
Yes, it is. Every single stroke patient, even the TIA patient that Abby was talking about, will get evaluated by a speech therapist, a physical therapist, and an occupational therapist. And then we also have a rehab facility within the hospital that you can be discharged to, that they see a lot of our stroke patients.
Okay. So you're sitting at home, Abby, and you feel something that just doesn't feel right. The first thing you should do is to run out, get in your car, and drive to the hospital.
I think you're joking when you say that.
Yes, I am.
Absolutely. So in those instances, you want to call 911. You know, you really want to not transport yourself to the hospital in situations where you have chest pain or any stroke-like symptoms.
Yeah. But if you are having a stroke, it's best to get the ambulance there right away anyway.
It is. It's one of those instances, we do a lot in healthcare these days about saying, call your primary care provider, or urgent care definitely has a place for small things like runny noses. But for stroke-like symptoms, we always want you to err on the side of caution and come to the emergency room, and because it's the only place in which we can evaluate it. And we would much rather rule out a stroke and send you home with some good information than you risk sitting at home and delaying time.
Yeah, I remember Dr. Sauter coming in and saying, we never care if you come in and you're not having the stroke that you think you might be having, because, why err? You might as well, if you're going to err on the side of caution. Sure. We're going to have the Citizens Ambulance folks in with us right after 9 o'clock because they've got their fundraising campaign. Their membership drive is going on right now. That vital communication, you talked about it, Sarah, between the ambulance and the ER really is important, isn't it?
We work very closely with them. And like I said, if you are coming in by any ambulance service, but we especially work very close with Citizens Ambulance Service, they can alert us before you're even there. So they can say, we have a stroke alert, we're about 15 minutes out, and we can be ready for you as soon as you hit those doors.
Mm-hmm. The medication that you mentioned is an indication of how much the treatment protocol changes for stroke. I remember when that was not available, and then when it was, all of a sudden it was like, hey, we have a game changer here. Mm-hmm. Does the game change all that much when you're dealing with strokes over a period of a year, 2 or 3 years, 5 years? Is it a constantly changing game, or are we getting a better handle on it? Might be the better way to phrase it.
I mean, I think we are. Yeah, I think we've had great advances in medicine from several years ago, not having interventions, to now having a great medication that does, break up clots in stroke. And most strokes, 80% of strokes are ischemic strokes. So the vast majority of stroke that we see, this medicine may be a great indication for many of those patients. And just going back to that, it's all about timing, because it's only appropriate to give the medicine within a time window of about 4 hours. So it's really critical that we see you early so we can determine if you're eligible for the medicine.
As a nurse practitioner, are you focused entirely on stroke, or do you have other duties?
We do. So the IRMC neurology team is currently comprised of 2 physicians, Dr. Sauter and Dr. Iannazi, myself, and another nurse practitioner, Wade Evans. And we work both in and out of the hospital to provide care to stroke patients, as well as a variety of neurological conditions, such as seizures, patients with epilepsy, dementia, Alzheimer's, really anything related to neurological problems. IRMC has a full spectrum of services for outpatients and inpatients.
Well, it's darn good work that you're doing there. And to get the designation again, Sara, is really an accomplishment. And when you consider other hospital facilities around Western Pennsylvania, this really is a focal area for our entire region, isn't it?
Yes, it is.
Yeah.
We have a lot of specialty care at Indiana, and we're very fortunate as a community.
Yeah, we really are. It's an indication of the hard work being put in there. Ladies, thank you so much for coming in to talk about stroke with us today. We appreciate it so much.
Thank
you.
If you bump into those Citizens Ambulance folks on the way out, just say hey for us, okay?
We sure will.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160 and AM 1160.